I had a particular interest in going to the Andes in Ecuador because after college I had worked for a year in Bolivia in a similar indigenous community, and that was what had inspired me to make a change of direction and decide to actually go to medical school. So it was a wonderful opportunity for me as a resident to have the chance to go for a month and work in a similar community and see things quite differently after having done medical training. The government of the city where we were, the Riobamba, had two teams that they actually sent throughout the indigenous community to different either actual clinics or just shell sort of buildings, and we were kind of a mobile operation. So we were dropped off every day in a pickup truck with a doctor or primary physician who was Ecuadorian, a nurse who interpreted from Spanish to the indigenous language, which was Quechua, and a dentist who carried a mobile kind of dental tools in a bag. And so I went every day to a different clinic, and we would set up and see, just by word of mouth, the word would be out there that, the doctors and the medical team were there, and people would just line up to be seen. So it might be just a few people and we'd be sitting there, or it might actually be, lined up out the door, 25 people waiting to be seen. You could never really predict. And things ranged from, the common cold to pregnancy that was, undiagnosed, to serious health conditions. Big challenge there is the lack of any sort of preventive care. So nobody is getting routine blood work, screenings for diabetes. Nobody's getting, their blood pressure checked, that sort of thing. So nobody is getting any sort of preventive care at all, and then just pop into these clinics. But there was a hospital that these people could go to, and it was, again, the setting with the big group patient rooms and nothing particularly fancy, but I believe the care was good. The government provided medications for free that we dispensed, blood pressure medicines and other things, as well as some pain pain medications. The cultural divide between the indigenous people and sort of the Western medicine is they have a very strong tradition of indigenous medicine, and so there's a lot of trust in that, and, that includes things like, diagnosing illness by holding a guinea pig over someone, and they like rub the guinea pig all over a person's body, and then they kill the guinea pig, and they then open up its belly and find out whatever the guinea pig had wrong with them is then the diagnosis of the person. And often when you're face to face with them, they're agreeing with you and saying they're going, expressing understanding perhaps of what you're saying, but then they'll also go and seek, kind of guinea pig medicine, and so it's challenging in that sense. I mean, for me, it was the experience of going back, and having been, having worked in a similar community with no medical training, and having gone down to teach health education and ended up, with people seeking medical care from me that I didn't feel able, I had no training, and that was overwhelming and really, it was very sad, and I wanted to do more, and now it was exciting to go back with medical training and be able to do more.
I mean, I was interested in going because of the hospital stay. I really wanted to see how the hospitals would work in the third world countries, such as Ecuador. And there were two hospitals that I worked at. One was a privatized Social Security hospital. The other one was a free hospital. At the Social Security hospital, pretty much everybody there that had any kind of respiratory complaint, and that probably included everybody, had a chest X-ray at bedside. And the results would be at bedside. The chest X-ray itself, you would have to go downstairs to the chest X-ray room. They'd shoot the chest X-ray, and they give you the print film and put it in the bedside. Now in the U.S., we have like the portable chest X-ray machines where you can pretty much get a chest X-ray on a park bench if you wanted to. Whereas here, you actually have to look at the actual films themselves. And they didn't even have viewing boxes. That's why they put them up to the window like they did here. One of the most rewarding aspects was dealing with the patients. I went into medicine, obviously, for patient care and to become a good clinician. And these patients were required good help, good support, and they were very appreciative of everything we did for them. And despite centuries or maybe even millennia of relying on traditional medicine and herbal medicine, they were still receptive to not only doctors but even foreign doctors and myself and my wife. They recognized that we were trying to help them, and they allowed us to be a small part of their health care. And just seeing that in a third world country was great, and also seeing the support system medically that they had available to them already, and all the social workers that would go out to see them in their homes. It was pretty rewarding for me to actually even see the support system that these people had, because of all these other workers there that devoted themselves day in, day out to their care.